Good afternoon, and thank you all for joining us today. With me this afternoon are IDPH Director Dr. Ngozi Ezike and Illinois National Guard Director, our Adjutant General, Brigadier General Richard R. Neely, as well as several industry leaders who I'll introduce to you in just a few moments. Illinois is a state with a grand history of profound impact on our nation. We invented the cell phone here, the first widely used internet browser, and the first skyscraper. Time and time again, the talented and forward-thinking people of Illinois who call this state home have stood up to meet the challenges of their time, and they've surpassed those challenges. Today, in the face of the unprecedented challenges presented by COVID-19, the people of Illinois have stepped up once again. Our innovative biotech companies and state-of-the-art manufacturers are teaming up with the state of Illinois to ramp up production of personal protective equipment, also known as PPE, through a newly launched alliance, the Essential Equipment Task Force. The Illinois Manufacturers Association, a statewide organization representing nearly 4,000 companies and facilities, will be coordinating manufacturers interested in donating or producing essential supplies that are FDA approved and sterilized. Things like N95 masks, gloves, gowns, ventilators, sanitizer, face masks, and more. Many of these companies are repurposing their facilities in order to meet critical demand. The Illinois Biotechnology Innovation Organization, also called iBio, represents 85,000 life science employees across the state. The organization has launched a COVID-19 response fund to make direct purchases of protective products at a competitive rate. Going forward, the Essential Equipment Task Force will work with the Illinois Emergency Management Agency to scale up to mass production of the FDA-approved PPE that Illinois healthcare workers need. I'm incredibly grateful to and proud of these Illinois organizations for stepping up to this moment. And we are lucky to have CEO and President of the IMA, the Illinois Manufacturers Association, Mark Denzler, and CEO and President of iBio, John Conrad, with us today to talk more about their collaborations and how their companies and organizations and other organizations can get involved. Mark and John will talk more about this later, but I want to emphasize to all of you, all of those in our audience today, that these factories will be adhering to strict social distancing guidelines to ensure that the workers behind the PPE are safe and healthy too. And I can't overstate how crucial this manufacturing capability will be in our fight against COVID-19. But we're not just waiting for in-state production. My administration continues to work day and night to scour the globe and the global supply chain. And today I can announce several new executed PPE contracts: 2.5 million N95 masks, 1 million disposable surgical masks, 11,000 gloves, and 10,000 single-use personal protection kits. I want to be very clear with all of you. Illinois' hospitals and nursing homes and first responders source and stock their own PPE. Additionally, due to the outsized nature of its need, the city of Chicago maintains a stockpile of its own PPE. Our state efforts are meant to supplement those and to support the institutions and municipalities across the state during this surge. I mentioned yesterday that we've had businesses and organizations from across the state contact us about donating additional PPE to support our response to COVID-19. These donations are counted separately from our existing supply. I would also like to make a direct ask to the owners of tattoo parlors and nail salons and elective surgery centers and other facilities temporarily closed during this crisis to contact my administration about their stores of PPE. If you or your business would like to help us protect our first responders by donating PPE, please contact us at ppe.donations@illinois.gov. That's ppe.donations@illinois.gov, and someone will reach back out to you to seek your donations. Since the beginning, I've promised you transparency and honesty on all aspects of our response. To that end, I want to take a moment now to run you through our PPE requests with the federal government and what we've received from them thus far. It's a long list of numbers, but I want to make sure that the public has all the information so that you can better understand where we're at and our efforts moving forward. The graphics next to me on my left also lay this information out and will continue to make this information available to you as we move forward. On March 6th, 3 days before we issued our disaster proclamation for the state, Illinois' version of a state of emergency, the state of Illinois proactively requested a shipment of personal protective equipment from the Strategic National Stockpile, the United States' largest reserve of pharmaceuticals and medical supplies housed under the Federal Department of Health and Human Services. The stated purpose of this supply is to support states as well as local governments during a, quote, public health emergency severe enough to cause local supplies to run out. We received our first, and until this week, our only shipment of supplies from the federal government on March 12th. It was only a fraction of our original request. We asked for 1.2 million N95 masks, 600,000 of which would go to the state, 600,000 for local governments, and we received 123,000 total. That's 10% of what we asked for. We also requested 900,000 surgical masks, and we received 45,000. We asked for 1.6 million gloves, 400,000 for the state and 1.2 million for local governments, and we received 163,000. We asked for 24,000 gowns, and we received a very welcome 45,000. We asked for 24,000 goggles, 4,000 for the state and 20,000 for local governments, and we received none. We asked for 120,000 face shields, and we received 56,000. We asked for 4,000 respirators, of which we received none. We also received 230 coveralls. My Department of Public Health directed a proportionate amount of these supplies to every hospital and local health department in the state that initially requested supplies, 150 hospitals and 62 health departments, then focused the remainder of those supplies on the other areas of the state in most need. On March 20th, we made an additional request to the federal government for PPE for our public safety workers. We asked for 7 million gloves, 1.74 million N95 masks, 900,000 gowns, 43,500 goggles, 85,000 bottles of hand sanitizer, 43,000 canisters of disinfectant wipes, and 1 million meals ready to eat. If you were listening really closely, you might have noticed that that was a different list of items, both in quantity and type, than our March 6th list. In response, the federal government sent us the same size order that we received on March 12th, but no goggles, no hand sanitizer, no wipes, and no meals ready to eat. This latest shipment has a lot smaller percentage of gloves, N95 masks, and goggles than we requested. I want to be clear, thanks to the willingness of Illinois' manufacturers to support our state efforts, thanks to private and public donations, thanks to experienced public servants inside the federal agencies and the military, thanks to the incredible pursuit of this supply chain by our Illinois Emergency Management Agency, our Illinois Department of Public Health, and members of my own governor's office. Illinois is acquiring PPE to compensate for what we haven't received in our federal requests. But we are doing so while running up against obstacles that should not exist. I have medical professionals and first responders begging for things that they need to keep them safe. But so does Governor Cuomo in New York. So does Governor DeWine in Ohio. So does Governor Inslee in Washington State. We're all doing everything that we can to do our jobs, which is to protect our residents and to make sure our healthcare workers have what they need. We need the federal government to use the Defense Production Act to help the states get what we need. It's the federal government's job to make sure that a nurse being properly equipped in Illinois doesn't come at the cost of a doctor being ready for work in California. It's the federal government's job to make sure that we have a cohesive, prepared, robust national response. It's the federal government's job to make sure that cash-strapped states are not paying more than they should have to for supplies, that we are not watching prices go up by the hour because we're competing against one another, yet for the common good. I'm an Illinoisan, and I'm a governor of Illinois. And I'm going to do everything that I can to protect our residents and get us through this crisis. I said I'd fight like hell for you, and I'm doing that every minute of every hour of every day. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones across the world to get as much PPE as possible shipped to Illinois. They're the force behind the 2.5 million N95 masks, 1 million disposable surgical masks, 11,000 gloves, and 10,000 personal protection kits that I just announced. And again, I'm an Illinoisan, but I'm also an American. And so long as I know that there's action that the White House can take, things like aggressively wielding the Defense Production Act or actually buying and distributing the supplies that they say they're going to buy and distribute, I'll do everything in my power to make that clear on behalf of the people of this state and the more than 300 million Americans who don't call Illinois home. Because that's the very baseline of what we all deserve. I want to close by once again thanking all of you for covering these press conferences so ably. I want to thank the citizens of Illinois who are stepping up to assist their neighbors and their families and their friends and their communities. And I want to thank the elected officials across this state in every city and town, Republicans and Democrats, who have been calling and emailing my office with leads on supplies and potential donations. You keep us going every day.